I also have some of your messages here, and I'll take some as we go on to talk about public education. I indicated that one of the biggest issues we are beginning to realize from COVID-19 is that people are underestimating the risks involved with COVID-19. So there are complaints that people are not listening, or is it that they're not even getting the message at all? I have, like I said, my special guest for today, who's head of the National Commission for Civic Education, Ms. Josephine Nkrumah, who's already here with me in the studio. You're welcome, Ms. Nkrumah.
Thank you very much for having me. Good afternoon.
Good afternoon. So before we go on, I just read some of your messages. I got this one that says, from what I see, everyone using okay, I'm not sure what you're trying to say, but you say everyone is not using face masks. So is it necessary for the fisher folk to observe social distancing since you're using face masks? From Nogo in Abo? Well, it is necessary for you to observe social distancing. Most of you are sending messages on the food prices, by the way. But yesterday and throughout this week, you've been sending me a lot of messages, especially from the eastern region, where you say education is extremely low. I want to hear from you if you are in these regions. But Ms. Nkrumah, it's good to have you. Very good to have you.
Yeah.
First of all, run us through quickly what the plan has been for public education on COVID-19.
Okay, so before we had any confirmed cases in Ghana, we had already begun some limited education, public education. It was usually on social media, and some of our district directors were also carrying out the social etiquette or the safety protocols regarding COVID-19. Once the disease was confirmed in Ghana, we stepped up education. But prior to that, we had also sent proposals to a number of institutions to support us by giving us funds to undertake education on the coronavirus.
Okay.
We know that coronavirus and this global pandemic suggests that the usual strategies that we employ, that involves social gathering, that involves one-on-one engagement, are all strategies that we can no longer employ. So we've shifted our focus to other strategies, basically doing a lot of public announcements using vans and public address systems, going to the lorry stations, the marketplaces where you have density of people converging and speaking to them about these issues. We've also stepped up our campaign on social media by generating educational content using audiovisuals for education on the social media front.
Okay. This afternoon, I'll just jump in there.
Yes.
We've been to the Central Business District. My colleague tells me that, and it sounded as if she herself was alarmed at the extent to which the market women there, I mean, there are men there as well, but, you know, women dominate, that the market folk don't seem to appreciate the times we're in at all. Do you have a specific plan for dense areas specifically, you know, starting from the Central Business District? If not, what can we do now that we've realized at least that something is wrong there?
Well, I think firstly we must establish that as a people we are very communal in our lifestyle, and so trying to change this, of course, will take a while. But these are times where every minute counts, so we don't have the luxury of time. And therefore, when it comes to the markets, we still go to the markets a lot. We've gone to the markets to educate them on social distance, but the feedback has always been, where do you want me to sit? This is where I always sell. If you tell me to move 2 meters away, basically you're going to deprive another person from his or her space at that market, and it will mean driving quite a number of people out of the market who won't be able to sell their wares.
That will create another set of chaos.
That will create another set of chaos. I'm happy, for instance, that we have things like directives coming for us to use face masks. That somewhat would diminish the risk of getting infected by other persons who have the coronavirus. So those are the challenges that we encounter on the field.
Okay, speaking of the field, I will come back to the challenges, but speaking of the field, I'm seeing some pictures here. These must be some of your people trying to engage. Yes. But we don't really see social distancing going on there. That is true. Tell us a bit more about these trips that you take.
So these trips, most of the pictures are countrywide. Okay. So depending on where they are and the groupings they're meeting, you would see them either close to the people or educating from the field, from the cars and on the roads. Social distancing has been our greatest challenge, trying to get them to understand that social distancing is essential. In fact, as you can see, sometimes when I've seen some of these pictures from my staff, I've called them and say, why are you standing in close proximity to the next person? We want to see you further away. We have to begin to practice what we preach. The challenge is people come close to you. So as you're telling them to move away, they are coming closer to you. So that is one of the basic challenges that we have.
Your men should start wearing, dressing up like they're at the treatment center.
Yeah. and I think that it's important. Our messaging goes to explain to them the reason why we have social distancing.
Okay.
So it's not just about telling them you should stand X meters away from your next person, but letting them understand that it diminishes or reduces the risk of you contracting the disease from a next person. See the next person as suspicious. See yourself as suspicious. That is the only thing that enables you to be conscious enough to take precautions, not only guard yourself, but also protect the next person from contracting the disease or contracting it from the next person.
Okay, so speaking about face masks and the directives that are coming in, this message is coming from, the person, sorry, doesn't write her name, says, can there be more education on how to wear the face masks?
Yes.
I see a lot of people wearing it on their chin or forehead. Too bad. Is this something that you're factoring in your next chain of education?
I mean, you understand that the whole pandemic is very fluid. From one day to the next, it changes, and therefore our messaging also changes. So as at yesterday, we're looking at the FDA requirements for certification and all of that, and we are putting together some audio visuals on how to properly put on your mask, take it off, and of course educating people on what are the indications that this mask is a good mask or otherwise. We are, as a commission, we're very worried about the number of masks you see on the streets of Accra. Every next hawker is now selling the mask, and so it creates this false sense of security, and that is very worrying for us. And so we hope that by Monday our visuals should be out, educating Ghanaians, and also giving my officers on the field the needed equipment to also begin to use that to demonstrate how to put on a mask and how to take the mask off, because that in itself, even though it is meant to protect, can end up being a conduit for the spread.
Okay, so before we wrap up the show, I have the conversation. I have a couple of messages here. Let's see if we can go through them. It says, hi Gifty, I'm in Adidome. I tell you, our education is very, very poor. What has been the situation in the Volta region?
The Volta region has also, the Church of Pentecost lent some buses to us, some minivans to us for our education. And so largely that is what we've depended on in each region to carry out education. We've had some support from some of the district assemblies as well, who have also lent their vehicles to us to carry on education. But I think we don't have enough of those items, of those logistics. So if I come to one community, it takes me a long time to come back there. But this is a lifestyle change, and it demands repeated and sustained education. That is something that we haven't been able to do, because the logistics are so limited that it will take a long while to come back to one place. So if you miss education, of course, it may take you weeks to come back to hearing. And so we are stepping up our conversation on social media, our conversation on media platforms, the local FM stations, the community radio networks. So you see that a lot of our staff also go there. In fact, some of the things they do first thing in the morning before they go out onto the field. So that is what we're doing now. Let
me go through the messages I have here. But essentially, the NCCE doesn't have enough money. That's the plain.
I think I am happy to share.
I'll come to that. Okay. I'll come to that. I just want to read. But but that's the truth. I mean, all organizations in this country don't have money anyway. But let me just read the messages I have here. It says, I don't really understand our leaders of this country. They were able to distribute free food during the partial lockdown, so they should come and do same with nose masks and hand sanitizers. From Mex Berlin in New Takrady. Thank you for sending your message. But as we have not had any alert that there's going to be free masks, please buy one if you can. It's also about your own protection, which is your responsibility. This one says, I wanted to know when a directive will come that pregnant nurses should be allowed to stay home. Okay, I learned some hospitals are saying they don't have any letter authorizing them. Okay, well, I'm hearing from my producers that most of them are already home. Pregnant nurses are already home. If you are not, maybe you want to speak to the regional health directorate, and let's see that. Let me see if I can point out the specific questions for the NCCE. This one is saying that it looks like the education is given on these issues are not enough. People around my area said there is nothing like COVID-19. All they say is that government is concocting the news. We want more education. Maxwell from Pandai. And you know that I asked about the Volta region. We got one from Adidome, and we are getting one from Pandai as well. People are underestimating it. Let me see if there are more than you respond to these ones.
As you go on, maybe I can just share that the Volta region, I think the northern region as well, the biggest challenge to education for us there has been the misinformation and the lack of the disbelief about all of this. We don't want to get to the stage that we saw in Italy or in Spain or in America, but because you're not seeing the suffering and what it entails, people just can't connect to the illness. There's a total disconnect because they're not actually seeing the devastating effect of COVID-19. All they hear is they say there is an illness.
So in that way, can NCCE come in with a plan that makes it visible for them what is happening in other countries? If you take Ecuador, for example, people are having to keep their dead relatives in their living rooms. Is there a plan like that?
Yes, we are looking at collating some videos in which we can share on the media, traditional media, use social media as well for people to understand the reality of what is occurring and to actually say we don't want to get to this point and therefore we need to take the steps right now to protect all of us. It is not the work of government only. Each and every one of us has a duty to do what he or she can to protect himself and protect your neighbor.
I think I'm coming to funding now. This text says some of the COVID-19 trust fund money should be used to support the NCCE. I have more, just a second. I saw one, says Gifty, I think the NCCE is doing well in terms of education because I believe they are working within the logistics they have. It's left to us Ghanaians to also adhere to the directives given. Pakwesi in Amfuega. Most of you are testing from the Volta region. Interesting.
I wonder why.
Keep watching. But if you're testing from anywhere, if you're watching from anywhere and you have a question or you have a suggestion for the NCCE, let's hear it. We have their boss here. Let's talk about funding.
Okay, before I talk about funding in a minute, we should understand that Ghanaians have largely, we've become an indisciplined society. And that goes a long way to determine how effective education is. Let's take what happened during the lockdown. Despite the lockdown, and even before lockdown, despite the President's directive on a ban on social gathering beyond 25 people, we saw what was happening. When you have security agencies on the streets of the lockdown areas saying to you go home, and people, despite this, people are going out. It begins to tell you that we have huge, serious underlying challenges that we need to confront head on. And I think that is also one of the reasons why people are saying that, well, the education is not going down well because people are still doing it. Ghanaians don't understand that we have laws, our laws work, and they must be made to work. I said on one of the recent media interviews that, for instance, when we saw people flouting these laws, the Imposition of Restrictions Act, what did we do? There was nothing available for us to tell that these people were taken to task, they were prosecuted, and they suffered consequences for these things. So when you don't hear these things, it also emboldens people to think that, well, somebody did it and got away with it. Yeah, so I can also do it. At best, what they'll say, don't do it again, or it becomes a foolish case. And that is one of our big challenges that we're having. Okay. For funding, it's true. We've had serious challenges with funding, with logistics constraints. This year, for instance, we haven't received any money at all from the government of Ghana.
The whole year? The
whole year.
How much were you entitled to in the budget?
This year, for our budget, our goods and services budget was 7 million.
7 million cedis. Yes, yes. And you've not received even 1 cedi?
We haven't received a cedi.
Why? Any explanations have they given you?
No, everything is on the GIFMIS systems, and the processes have been duly executed on our end. What is left with is releases for, so we're in Q2 basically, and we haven't received it. So all we've been able to share with our staff is 100 cedis per district to undertake.
Hold on, what did you just say?
Yes, you just heard me right. 100 cedis.
100 cedis per district?
Yes.
For what?
And we sent the 100 cedis just for them to buy sanitizers and masks or gloves where available. So that is a major challenge for me, that day in, day out, my staff are on the ground carrying out civic education, and there is nothing to protect them. But I'm very happy.
But hang on.
You don't like the good news.
No, I don't get it. We're talking about education, which is
pivotal.
Exactly. And that's, I mean, communication is the way that we get this thing. We get people to hear even that there is a disease. Yes. So usually, how soon do you get your money? I mean, this is, we're in April, right?
That's the third.
So typically, you'd have received your money in the first or second? Second?
Usually by the second month of the first quarter, we should be receiving something.
But
it's usually not a lot. But this year, we haven't received it. But
have you engaged?
Yes, I mean, all that we need to do, you have a budget, you know the processes you have to follow for you to get your releases. We've done our part, the money has not been released to us. But you see, the important thing is that we're not sitting idle. We're not saying that because we haven't received money, we're just waiting for money to come. We were proactive. Before we had our first confirmed case, we submitted proposals to agencies of state to look at it and support us in anticipation of COVID-19 touching the shores of Ghana. Nothing came out of it. We have actually started work. Listen, what you see on the TV, a lot of it is with the kind courtesy of the Church of Pentecost. The Church of Pentecost gave us some of the advance to enable us carry out civic education. So we've had 12 vans for the Church of Pentecost, 10 in each of the old regions, and 2 in Accra, the Greater Accra and Ashanti region, which are deemed to be the epicenters of COVID-19 in Ghana. And the Church of Pentecost not only did that, they also gave us fuel. So they fuel the vans for us, they pay the drivers for us, and we go. So as the picture you see, for instance, is a Church of Pentecost van, and that is one of our members of staff carrying out civic education. About a couple of weeks ago, we were fortunate enough to get fuel from Shell, Vivo Energy Ghana. They are supplying fuel to our Western region district offices as well. We had some support also from angel group of companies. They donated some cartons of sanitizers to Ashanti region, and in the Ahafo region, the Asunafo Farmers Cooperative donated 2,000 cedis to our regional office, in which we shared 200 per district to enable them engage in civic care. So you see my staff there. Do you see any of them wearing any protective equipment? No, nothing. And so every day I sit down and I worry, and I'm constantly saying, be careful, be careful. You know,
I mean, when it comes to PPEs, there are several donations. Has the NCCE received any?
Nothing.
Not from government?
Nothing from
Not
government.
even from private companies?
No. Like I said, we had sanitizers from the Angel Group of companies for our Ashanti regional office. But Gifty, I'm happy to say that we are getting some positive indications from the Office of the President as at this afternoon.
Which is?
That suggests that we would be getting some PPEs. They will find a way of ensuring that our logistic challenges are addressed.
You know, when you said you have had some positive news from the presidency, I was hoping that you're going to say that the money is coming tomorrow or the money is coming next week.
We only heard it this afternoon. So we believe very strongly that the government is committed to the cause of COVID-19 and you know, doing everything it can to fight COVID-19. And now that it's come to their attention and there's been indication that they're going to support the commission, we hope that in the next week or so we should see some positive steps, and then it will allow us to engage effectively, enhance civic education, intensify it, and hope to make the change that we so crucially need to fight this disease.
Let me just read some of the messages I have. This texter says, no funding to such a critical agency this year. Such poor governance must be exposed. Well, let's focus more on the problem and how we can deal with it. Good evening, Gifty. This one says, an honorable NCCE boss, Minna Hunter of Edubiase, is texting, the NCCE has become redundant in nature when it comes to sensitization of public on so many issues, even before COVID-19. The issue here is, why are they not being proactive and patriotic enough, especially within this pandemic situation, but rather rely on government? The nationals of this land are becoming selfish, and only God can save us. Thank you.
I think I want to respond to that comment. I think it's a very unreasonable and unfair comment to pass, considering that we haven't received any funding, but we are still working. And I think that it's important that before people mimic this refrain every time NCC is not working, they should take the time to find out what actually is happening. If you take the time to go on our website, you will see so many pictures and videos that show you what we're doing. If you take the time to go on our social media handles, it will tell you same. And if you take the time to listen in to various local FM stations and whatnot, you will hear that, in fact, we are doing the best we can under the circumstances. And
let me read
should be my officers really should be commended for the yeoman's job that they're doing.
Which is what message someone has sent in. It says, what Madam Nkrumah is saying is very true about the underfunding of NCCE. I have a friend who uses part of his salary to do education, even before COVID-19 in the Bono region. Institutions like them deserve to be taken care of. So someone has answered that the previous texter for you. Okay, says, please, if I may ask, Gifty, our mothers don't understand what is going on, but they have just failed to adhere to instructions. Why is it that places we think the education hasn't gotten to, we will find people still wearing masks? So others are wearing masks in the same places that people are not. Our security should work. Prince is sending us from Obuasi Council Quarters. He says, if I may ask, you and your are you and your department? Okay, I'm not really getting that message, but the first one that you sent, I understand clearly. Okay, looks like I read this one. Let me see. Okay, this one just says, so the messages, I've asked people to send us messages on what they are getting in the markets, because there's also the market conversation that we should have. So it's quite mixed up, and I'm trying to get the NCCE related ones. Okay, let's see, this one is one of them. I'm watching live, okay, inside Hohoi from Francis. Enemies are not God, he says. Okay, says, won't it be good if the NCCE engages institutions like agric departments in the COVID-19 education, as they have their staff in almost every community? Parkwesi and Amfwega.
I did indicate that the NCC is collaborating a lot with district assemblies, and so for some of our districts that don't have vehicles, the district assembly has made a vehicle available to them, and there's in some cases fuel in the vehicle for them to carry out education. So the district assembly collaboration and the relationship between our officers and the district assembly has been phenomenal in shoring up the kind of work we ought to do.
Okay, this one says education in Kumbungo district in the northern region is very difficult for the nurses working here. Some people say they don't see anything on TV to serve as evidence. This is the northern region.
For the nurses? To
serve as, no, so the work for the nurses is becoming difficult because people don't seem to appreciate the times we're in.
Is it the issues around stigmatization?
No, he doesn't really say anything. He just says education in Kumbungo district in the northern region.
As I said to you earlier, you know, we've had these vans and there's only so far they can go in a day and then come round again. So if we had more vehicles, it enables us to reach out to the people, for it to be more sustained, repeated, so that the message gets down to the people. So the moment we have more vehicles, we have fuel, I'm sure that people will be hearing a lot more from us.
Okay. Says you will be marveled at the work NCCE does despite their inadequate budgetary allocations. They need adequate funding because they are capable of educating the public on mitigating on mitigating the effect of the pandemic. Charlotte is sending this from Dansuman. What advice did the chair of NCCE give to the president? Okay, can you give to the president if given the chance?
Well, I think we all know that education in these times cannot at all be underestimated. And given that education has a huge role to play in combating COVID-19, the adequate resources that the Commission needs must be urgently supplied to them to enable us as a Commission to work effectively. And I think when we understand that lifestyle changes and our attitudes contribute largely to fighting COVID-19 or COVID-19 defeating us is a matter of education, we would be able to address the issue of COVID-19. Yes.
Razak is texting from Wenchi. Razak says the governments must pay attention to the NCCE. I did my national service there, and I can attest that they do more with their meager resource. Razak, I'm sure she's very happy to hear you text. Madam Nkrumah is very right. Successive governments have not been fair to the Commission at all. All right, thanks for sending in this one as well. Okay, most of you are asking about how you can get free face masks for your community.
And we get that all the time when we go on the field. They want face masks, they want sanitizers, and they want...
For free?
Yes. In fact, a few of my district directors, it was aggressive. So they had to drive off.
Wow.
It was basically, if you're not giving us sanitizers,
don't come and talk to us
about education, get out of our space.
Well, I think that if government decides to go on a free, distribution of face masks, then the NCCE could be one of the critical institutions they could work with.
Certainly,
since you're always going out there.
Yes.
This one says, it looks like the education is giving on. Okay, I think I read this one already, but he's saying that please stop the Accra kind of education. Come to our area.
Oh, we don't do Accra. You know, the beauty of the work we do is that our district directors and officers in the districts speak the prevalent languages in the districts that they operate in. So when it comes to education, it's not about speaking English. It's about getting down to the grassroots and speaking the language they understand in order to communicate effectively.
No, I think his concern is not about the language. I think it's about the focus of the discussion and the education. He thinks that the education is focused on Accra.
No, not at all.
Okay.
Not at all. Not at all. It's very fairly distributed. In fact, we think that in areas where there's population density like Accra and Greater Accra, it's not even enough. We need to see more because that's where you have so many people. But in areas, perhaps in the northern regions, for instance, you see that the communities are very, widely spaced. And so you go to one location, you have to drive a long distance to get to another location. But the flip side of it is that even in areas where there's population density, one of our challenges is accessing the communities because some of them are so densely populated, so packed that you can't go through with a vehicle. And so that also is a challenge. So we are forced to just park on the road and then speak, you know, across to the people.
Okay.
Whereas if we had maybe a motorbike or something, it would be easier to get deeper into into those communities.
We'll be wrapping up shortly. This one is texting from Norway. He's a Ghanaian living in Norway. Says, can Madam tell us why they are not getting funding from government, and also ask her to give us their social media platforms? Is the commission an autonomous institution?
Yes.
So 3 things he's asking. Whether you are an autonomous institution, when you end with that, what are your social media platforms? How can people get on your social media platforms, and why are you not getting money?
I'm not in a position to say why we're not getting money. It's not new, but I hope that the tide changes soon. Our social media handles for Facebook is NCCGH. For Instagram, it's NCCGH1. And then for Twitter, it's again NCCEGH.
NCCEGH1?
Yes, that's for Instagram.
Okay.
And then for Facebook, it's NCCEGH.
Okay.
And then for
NCCEGH. Okay.
And for Twitter, it's the same NCCEGH.
Okay.
Yes, we are an independent governance institution, so we don't serve under any ministry as mandated or as enjoined by the commission.
Okay.
Sorry, by the constitution.
Okay.
Sorry.
The stubbornness of Ghanaians, Madam mentioned, is because NCCE constituents have not been reached, because we seem to focus on the upper and middle class, literates and the likes. She disagrees.
I totally disagree. You saw the pictures. You saw some of the pictures. We are down at the grassroots level.
Okay.
But for us, it's not just the grassroots. We must reach all segments of society. And that is why we use the different platforms to engage the different segments of society.
Okay. From day one, NCCE has been taken away from the education. The emergency response team at all district level, NCCE is out. Thinking that information department is more important than NCCE. Chris is sending that from Sunyai. How do we address this issue that Chris has brought up?
It has come to our attention that in some of the districts, indeed, NCC is not part of the core team that is fighting COVID-19 at the district level. But I must also say we've had phenomenal support from other district assemblies as well. So it is a mixture, but we believe very strongly that as we go forward, we will address these issues by constantly engaging with the district assemblies to understand that the NCC has a crucial role to play as well. Okay.
Well, we'll have to wrap up this conversation. There was a particular message that I'm looking for. There was someone who was wondering why you were happy or why you were describing the news you heard today as good news. But I didn't get the rest of the message. I just read the first line. I'm trying to find out. Maybe this is it. Says, no, he's talking about the funding. Right. He was still wondering why you're not getting the funding. She says she doesn't have the answer to that at the moment. But I'm hopeful that the appropriate institutions will hear this and get to work on that. Ms. Nkrumah, before we let you go, what are your final words?
My final words are to let Ghanaians understand that the fight against COVID-19 is not one that is exclusively for government. It takes every single one of us to beat the disease. And so I'd urge Ghanaians to adhere to the safety protocols and etiquette. I'd urge Ghanaians that they should listen in and should seek information about COVID-19 and how to beat it. And also caution them that we should be looking for information at credible sources. The WHO, the Ghana Health Service, the Ministry of Health, some of our own media online platforms. These are critical. But finally, I'd like to speak to the issue of stigmatization, which is a creeping one for us. It is very worrying because stigmatization in itself becomes counterproductive to the fight. The moment people begin to feel that they will be stigmatized because of the disease, even when they begin to exhibit the symptoms, they will conceal it and continue to live amongst us instead of isolating. So I want to urge Ghanaians that if you stigmatize, you spread. We must begin to understand that for us to win that fight, stigmatization must be eradicated at all costs. Let's all take this disease seriously and fight it as one nation so that we come out victorious.
Okay, that's a message from the NCCE. I think I found the message I was looking for. I'll wrap up with it. He says, what is the NCCE boss saying? That they have heard good news from the office of the president when the government has failed to fulfill its mandate to the NCCE. This is a total failure on the part of government. Abbas takes that from Tamale. He says, anyway, I would suggest that the government use part of the COVID-19 trust fund to get some logistics for the NCCE.
Better late than never.
Okay.
Better late than never.
Okay. So it's been great having you. Thank you for so having me, for coming.
It's a pleasure being here.
And hopefully 100 cities, seriously, 100 cities for each district for communication. And that 100 cities is supposed to be used for hand sanitizers, really. I mean, I don't know. I'm lost for words. But if you have any support you want to give to the NCCE, I hope that, I mean, I guess this is the time to do it. And if you have is there a Momo number? Is the NCCE even allowed to do that? I don't know.
Well, not this way. We usually do that with development partners.
Okay.
But these are difficult times, and you can decide to do that through the various offices that we have. Okay. Countrywide.
Okay, so if you want to support the NCCE to do the work of education, which is key, which is really important,
just call at our offices.
Okay, so any of their offices, they're all over the district. NCCE offices are all over the district. I believe you can be found in any of the
districts,
MMDCA.
Yeah, most of them are situated in
the
district assemblies.
Okay,
yes.
So you can find them also on NCCEGH1. That's for Instagram. NCCEGH for Facebook and Twitter, and you can get to know more information about where you can find.
And for our website, nccegh.org.
nccegh.org. If you want to support the NCCE, they're working with 100 cities each district, and that they're using to buy sanitizers to educate people on the need to, for example, wear masks or to stay safe or to stay at a safe distance. It's really frustrating, but I hope that some help come very soon. Josephine Nkrumah is head of the NCCE. She's been my special guest for today.
Thank you.
It's been an amazing conversation. I hope we can have another someday when things are much better and there's a much
and we
more
will have positive news.
Hopefully.
Yes.
So, if the institutions are listening to us, especially the finance ministry, because I believe that's where the money is supposed to come from, the NCCE is waiting for money so they can do much more of the work as far as education is concerned.